All right, I think we're at critical mass. So let's get things started. My name is Mariah McGow. I'm the communications director for Vocal New York. Good morning, everyone. Today we're here to talk about the roadmap that I'm sure you've all seen about how to spend opioid settlement funds across the nation. So just to backtrack a little bit, Vocal New York is one of 130 groups that signed on to this roadmap guidance. And that includes that list of 130 plus includes service providers, public health experts, all supporting, the guidance of how these opioid settlement funds should be spent. So just to touch on the roadmap a little bit, I'm sure you've all seen it, but really it's a guide for how policymakers and public health officials should distribute this $50 billion settlement fund. But we're really here to emphasize that it's more than a roadmap. It's really a warning to policymakers that if these funds are mishandled and funneled into criminalization, it's only going to make our crisis worse and cost more lives. Some more context is, the roadmap came together from these organizations working on the front lines of the preventable overdose crisis. And together we're calling on states and counties and municipalities to adopt these priorities because we know they will save lives. The folks you'll hear from today know firsthand what drug users are going through and what the people who are supporting drug users are going through, and what we're up against. And so while the roadmap and the signers of the roadmap come from different states and regions and political landscapes, we are united in calling for divestment from criminalization and investment in life-saving harm reduction strategies. So before I turn it over to our panelists for our discussion, I wanted to underscore and thank all of the reporters who joined today. We know certainly that headlines, especially sensationalized headlines that are rooted in the failed war on drugs, can have a chilling effect on policies and funding. So we're so grateful that you joined today. You play such an important role in harm reduction and how it's perceived around the country. And we're excited to have this conversation. And also want to make sure that we're basing the conversation in a lived experience, fact, and a commitment to ending preventable overdoses. So with that, I'm going to let our panelists introduce themselves, and I'll hand it over to Shamika first, if you want to go ahead.
Good morning, everyone. My name is Shamika Parrish-Wright. I am the Executive Director of Vocal Kentucky. Voices of Community Activism Leaders is what Vocal means, and we are a statewide grassroots membership organization that builds power among low-income people directly impacted by homelessness, the drug war, mass incarceration, HIV, and AIDS. We accomplish this through community organizing, leadership development, advocacy, direct services, and direct action. And I am honored to be here as representing someone who is directly impacted by every one of those issues, including the opioid crisis, as well as my team, membership, and leaders. Thank you.
Thank you, Shamika. Good morning or afternoon almost, everyone. I'm Elizabeth Burke-Beatty. I am a person with lived experience. I'm a certified peer recovery specialist in the state of New Jersey. And I'm also the founder of the National Sea Change Coalition and Sea Change Recovery Community Organization. Through both of those organizations, I co-direct and organize with the Not One More campaign with New Jersey Organizing Project, where together we're meeting at this intersection between direct services and organizing and fighting for decision makers to be really good stewards of these settlement funds nationally and in New Jersey on the state and county levels. And thank you for being here.
And hi, everyone. I'm Vinay Krishnan, he, him pronouns, calling in from Brooklyn. I'm the national field organizer for the Center for Popular Democracy. And we're a national network of 48 affiliate organizations in 33 states and also DC and Puerto Rico. And we're fighting for healthcare justice, immigrant justice, worker justice, climate justice, and also fighting to protect our democracy. And we're a Black, brown, immigrant-led organization. And I run our Ending the War on Drugs network, which is a network of folks across the country working to secure investments in harm reduction and work to curb overdose while divesting from police and prisons. And right now we're doing a lot of work on settlement funding. So I'm happy to be here to talk this through with all of you. Thanks for having me.
Hello and good morning. I'm Tricia Christensen, the Director of Policy with Community Education Group. CEG works on issues related to the syndemic of HIV, viral hepatitis, and overdose throughout rural America, but a particular emphasis on the Appalachian region. And we've been tracking how the 13 states of Appalachia are managing and spending their opioid settlement dollars, including cataloging spending decisions in a public database.
Awesome. So those are our, excuse me, panelists. And so before we jump into it, just an overview of what today's conversation will look like. I'll be asking a couple different questions, one to each of our panelists, based on their different expertise, connected to the roadmap. And then after that, we will open it up for a Q&A for all of our attendees. And so on that, there are a couple options that you can go with. Throughout the conversation, you can drop a question into the Q&A. They will stack, and I will get to them at the end, and we'll go one by one, and basically read out the name. We'll unmute you, and then you can ask your question to the group. If you don't want to put it in the Q&A section, feel free to write it down or hold it until the end. But basically, we won't be doing raised hands. We'll just be typing your question into the Q&A. We'll unmute you, you can ask the group, and then we'll go through the list that have stacked up or that are adding to. So that's the process for questions at the end, but we will have a section for those. And I think that's all the housekeeping for now. So with that, I wanted to kick off our conversation by asking a question to Vinay. And so Vinay, in a few words, why is it important that these funds go to programs like public health services and housing specifically? And, at the same time, why is it important that funds not go to law enforcement or carceral responses?
Thank you, Maria. Yeah, thank you for that question, because that really, I think, gets the crux of why we're all here today, to make sure this money is spent properly on programs that keep people safe. And the good thing is we already know what keeps people safe. We already have the answers. This isn't like a mystery. This isn't something we have to figure out from scratch. We already know exactly how to do this. We know how to keep people safe as they use drugs. We know how to curb overdose, and we know how to do it in a respectful way that honors the dignity of these people, of our communities. And that's harm reduction, right? That's why we're here. And what does that mean? That means medication-assisted treatment, including buprenorphine and methadone. It means drug checking, syringe exchange programs, overdose prevention centers, and housing too. Some folks don't often think of housing in this context, but housing is a healthcare intervention. Housing is harm reduction. You can't manage addiction or chronic illness or disability without a stable home. So it's housing too. And we've seen that these things work. We know these programs work. Here in New York, we have the first 2 overdose prevention centers, the first 2 legally sanctioned ones, and they've saved over 1,000 lives since they opened last November. So we see firsthand that these things work, and we've seen that all across the country and in study after study. So we know what works, and we also know what doesn't work, right? We know that police, prisons, carceral approaches, criminalization does not work. You can't arrest your way out of a public health crisis. And when you attempt to do that, you actually hurt public health outcomes. And we've seen for decades now that the war on drugs has ripped families apart, filled prisons, cut off people from the social supports they need to survive. And these folks are predominantly been Black and brown, less wealthy communities, disabled communities, and over again, they've been exposed to police violence, to state violence. And obviously that's not good for public health. And just to drill down briefly for like one example, lots of the folks like we're all representing here, they lost family members to overdose because police make it almost impossible to use drugs safely. And these settlement lawsuits were supposed to provide some semblance of repair, some semblance of justice. Obviously, it's impossible to fully do that. but some semblance of justice. And now those funds in lots of cases are going to those same police departments that ripped those families apart in the first place, right? So that's heartbreaking to our people, that's enraging, and it's unacceptable. And it's preventable, right? Because there are alternatives. So just to wrap up, like, we know what works and we know what doesn't work, and harm reduction works. We've seen it over and over again. And what we have right now is a unique historical opportunity to funnel billions of dollars nationwide into harm reduction. And if we do that, we can transform healthcare in this country, health, drug policy in this country, and we can keep folks safe, keep our communities safe. So that's what we're trying to do.
Thanks for that, Vinay. That was a great answer that really got to the heart of the roadmap, and such a great answer. I wanted to remind folks that we are recording this as well, and we'll make sure that a recording gets to folks after the discussion. So to keep it moving, I wanted to turn to Trisha now. And so Trisha, you track opioid settlement developments across the 13 states of Appalachia, which you're really great in telling me that I how to pronounce that, Appalachia. So what are you seeing in terms of spending across those 13 states, both good and bad?
You can remember by saying, I'm going to throw an Appalachia if you say it wrong. Okay, so we are seeing a lot in terms of spending already. I should say, kind of a note regarding timeline. Even just among my sampling of 13 states, although I think this is sort of the case across the country, we're seeing some states that have already allocated funds. So we have some really solid information about how they're spending their money. Other states are just now starting to organize some kind of like opioid settlement authority. Maybe they're talking about priorities, but haven't necessarily spent a lot. In other states, like not a lot is happening, or they're somewhere in the middle, right? So we're all over the place. But based on what we have seen, I've seen many examples of investing in treatment services. So that's including medication-assisted treatment in various settings, which is wonderful and needed. Unfortunately, we are seeing a lot of programs being funded that are known to not provide or even allow the use of medications, which we know is the gold standard treatment for opioid use disorder. So there's quite a variety of what funding for, quote, treatment really means. And it's not always clear from press releases or media coverage what the details of the program are. So I know on our end, we do what we can to sort of dig into that, but it's not always possible unless you really are familiar with that local context or that local program. We've seen in a lot of states some dollars used for employment in different ways. So I've seen some like scholarship programs to incentivize folks to work in addiction services. I've seen investment into second chance employment or recovery to work initiatives. So those like provide opportunities for people in recovery or post-incarceration to build a career while also working with the employers to ensure that they are recovery-friendly workplaces. And I've seen a lot of examples of just plain like hiring new people, maybe a new peer recovery specialist in various settings or some kind of like medical staff. Another interesting example that I've seen in some jurisdictions is thinking about drug supply surveillance. I've seen some jurisdictions considering funds for wastewater testing. So the idea being that they could identify drugs in the local supply. I would rather see funds go to more like robust drug checking programs, which North Carolina has done to their credit. Not only can help with the broader surveillance of the drug supply, but it also can help share that information with people who use drugs so they can know what's in their drug supply, perhaps make some changes to their behaviors if they want to. Some innovative thinking I've seen around like how to blend and braid funding. So for example, some counties are using their ARPA funds, American Rescue Plan funds, to build a new treatment center. And maybe then you're using opioid settlement funds, maybe mixed with other like federal opioid response funds to support operations. So thinking really strategically about how to like connect all those dots, all those different funding sources. What I think is most interesting is how some areas have been investing in their communities. So thinking more broadly about building out robust recovery supports, including legal aid support, investing in transportation needs, especially connecting people to treatment or other medical needs. There's also been a lot of creative thinking about primary prevention by investing in like parks or libraries or other public spaces. I think that's something that's really unique about these dollars, is that we can think creatively about what opioid remediation means and like really think upstream. And then the last point I'll make, of course, we've seen a lot of talk, a lot of media coverage about how settlement dollars can be used to support law enforcement. So some jurisdictions have proposed using funds for law enforcement overtime or for purchasing supplies ranging from computers to guns and vehicles, which I would argue is not a good use of funds. And there probably are other funding sources to go for those types of things if that really is a priority in that community. On the other hand, a sheriff's office might get funding to implement MAT in the county jail, or maybe to establish a diversion program or a drug court program. In those instances, the nuances of the program will determine if I personally think it's like a good or bad use of those funds. But generally, I think it's good to see funds being used to support people rather than to criminalize and stigmatize them.
Thank you so much, Trisha, for adding a bit more color to some examples to what that spending looks like. So now I'm going to turn it over to Shamika with our sister chapter in Vocal Kentucky. And so, Shamika, let's get down to some specifics. So not too long ago, the first round of funding was announced for the state of Kentucky. I wanted to ask if you're happy with the funding, what were your feelings about how that funding was allocated? And were there things that were funded that we had flagged in the roadmap that we're suggesting that are funded? And then, you know, what are we seeing with settlement funds being spent strategically on things that don't have funding from other sources? So tell us more about what that's looking like in Kentucky.
Thank you, Mariah. And I'm going to piggyback some of what Vinay and Trisha said, but also add that Vocal Kentucky created our very own roadmap with our community partners in 2022. And we introduced it to our local and state government, and it was well received, but we wanted to make sure that there was follow-up and that they knew that we would be following where this money would be dispersed. This funding is not enough to fix all the issues related to the opioid crisis, but it can be used to fund a menu of services. And just as my colleagues have spoken before, over time, we know that this money can be used to help improve and save lives. And so our abatement commission is under the offices of our Attorney General, Daniel Cameron, and they've held a series of town halls across the state. And we have made sure that we've attended those town halls to make sure that we are looking at who's showing up and talking to people about who will apply for the money, and also reducing some of the red tape it takes to apply for this funding, because we know a lot of smaller groups and organizations and those who are doing direct services don't necessarily have the administrative capacity for a 27-page application. And so the application was reduced to 15 pages. We've seen the money prioritized around groups who are on the ground delivering services. The first round of our state funds were allocated in the spring and April, but they still haven't received those funds. So we're asking for a real timeline that is tangible so that these groups who provide life-saving services can know when that money is coming. Our local funds, we have 120 counties, and we at Vocal Kentucky have 120 county approach, and we're definitely making sure those in counties that were impacted the most we're following that money and making sure that it's getting dispersed. The problem is, as has been shared before, they've been stuck in setting up processes, but we do know that our local in Jefferson County, for example, our newly elected mayor, who agrees with our roadmap, has also said that he would set up within the next month a commission to help make sure that that funding goes to the people who need it most. But we want to make sure that people on that commission have also actually experienced opioids and also know what they're doing, because we know that those who are closest to the problem should be leading in the solutions. We also have seen that some of the state money that was dispersed over the state was allocated to law enforcement, and we were not happy about that. As far as the crisis that we're dealing with, we know that our law enforcement cannot get us out of this, but they need to be a part of it. The only example we think it makes sense to have that money go through law enforcement are law enforcement that focuses on arrestless interactions, that distribute harm reduction supplies, and that are making warm handoffs to services and agencies and organizations that can carry on that work. We have seen some examples of that, but we will continue to follow. Their descriptions were very vague and said they would connect to community community groups. So we're going to continue to follow it. And I will follow this up with saying that groups that are closest to the people who currently use should be at every turn of this. And so we've been making sure that we show up to make sure that they're engaged in the decision-making processes, and that recovery includes all the things. And so anyone that is dealing with this, we know that the data that is collected should never take away from an individual experience. And like my colleagues have shared, housing first with services, transportation, and harm reduction and care has to be our priority. And it's not enough money to be spent that we need, but over time, we think that it can seriously start to deal with the impacts, and there needs to be real timelines for disbursement so people can plan that out. We've had local service providers and across the state who've had to slow down their services because they don't know when that money is coming. So we're focused on making sure we continue to hold our elected officials accountable, and we continue to follow that money to the ground.
That's awesome, Shamika. You're really underscoring transparency, and then also the need for folks who are directly impacted to have a seat at the table, for sure. Okay, so I'm gonna turn it over to Elizabeth for our last question, and then we're gonna open it up for Q&A. So Elizabeth, the roadmap has a section on ensuring a transparent and inclusive process. You know, your group is made up of people that have been directly impacted. Do you feel like your voices are being heard? Have you adequately been included in decision-making processes? And what's your strategy to change that if not?
Thanks, Mariah. Thanks, everyone. You guys are on fire. So are we being included in decision-making? Only where we really insert ourselves and speak up and show up and keep speaking up and showing up. Have we necessarily been invited? Not so much, but we are stepping in anyway. So with our Not One More New Jersey campaign, we're made up of just over 300 people directly impacted by the overdose crisis and or substance use disorder, and also people who choose to use drugs. So we did research examining the representation of New Jersey State Council and councils of 2 local counties that we organize in. We found that we have not been adequately represented. We knew that, but we wanted to prove it. And only a small fraction of the council members have lived experience themselves. And at the state level, most of those people with lived experience come from urban centers, leaving behind the perspective and barriers of rural and suburban communities that are most impacted when accounting for population per square mile. And we have what we call, in our research, we have a map that identifies the hotspots. Those hotspots are not being represented. So what we're doing, as when I talk about Not One More, just to really clarify, Not One More is this intersection of people either using drugs or with lived experience through services we provide at Sea Change, coming into organizing with New Jersey Organizing Project. And together, that's where we've, built this over 300 people actively organizing together. So as a unified sort of groups coming together and teaching people how to organize, we're taking a really proactive approach to building our base and power in these hotspot communities where people are underrepresented or not represented at all. And we're doing that through, if you're in the organizing world, through deep canvassing, where we're meeting, we're taking those stories, we're taking all of the information we do through deep canvassing, and we also teach harm reduction on the way that when we do that as well. And then we go meet with decision makers, and we keep showing up on local and state levels to voice our concerns and to be a voice for these people that are being not included. So we keep doing it over and over and over. And oftentimes we're finding that they're going to, of course, talk to the council, and if they do an exploratory meeting, and then we find out the council didn't know anything about us or what we've said. So we just keep showing up at the state level. We keep going to Trenton. We keep going to county councils. And also, like Vinay and Shamika and Trisha explained, like there's still a lot of information that we can't access. We've dug really hard in a few counties where we know that apparently none of the money's been spent. But in certain counties in New Jersey, we don't even know who's on the council for their county. And we can't get those answers. And I as of yesterday, I saw some new funding programs to a sheriff's office in one of our counties. And I'm just questioning, and that's one of the places that said that are not releasing any information about how they're using their opioid settlement funds. So we are not only services and boots on the ground and providing harm reduction and saving lives on a daily basis, we're teaching those people how to stand up and speak out and join us in this fight. And that's all I have for my question.
Thank you, Elizabeth, so much. Yeah, I feel like that super helpful to hear how directly impacted folks are being included. And then Vinay, did you have anything you wanted to add to that?
Sure. Yeah. Thank you, Elizabeth, for that insight. I was just thinking that I've heard from some of our folks on the ground that who are doing this work in states, that sometimes a board or trust who's deciding where the money goes will include directly impacted folks. But then you find out later that the trust just has an advisory role and the legislature can kind of just ignore them. So it appears as if they're doing the right thing and including our community members, but it's almost kind of like in bad faith, just like a public kind of thing. And then behind closed doors, they're ignoring that advice. And then so that's one thing to look out for. And then also like directly impacted could mean lots of different things, right? So many different things could be under that umbrella. And someone who, exited an abstinence only recovery program 20 years ago, they could count that as directly impacted, but they would have a very different opinion than someone who's like just using a harm reduction program right now or providing harm reduction services right now. So there's two different forms of directly impacted. So definitely like do that extra homework if you're doing this work in your states to figure out who's actually making the decisions.
Exactly. If I could just add one more thing to that. So it's, these councils are advisory. And like Vinay said, and that in Ocean County in New Jersey, the council is advisory to the county commissioners. And most of the research we've done so far on those commissioners is, not a lot of support around harm reduction and not a lot of education around substance use disorders. And so, I've had even a harm reduction center that we work with, they have been granted a funds for a van, and they're trying to come down to our rural area and nobody's letting them park the van, and so they're being sort of held at bay and asking me how I do it, which is just, going straight to the houses and the tents or wherever. So yeah, it's really concerning that these councils that we're hearing so much about don't really have the final say. So we
Can I just add?
Yeah.
Thank you for that, Elizabeth. You reminded me, for us in Kentucky, our council does have our commission has a great deal of say. What we've been trying to do is make sure that the groups on the ground aren't drowned out by the usual suspects who apply for the funding. And so we're also using the fact that this is a very, it's an off election year, but it's a governor's race year. And so any type of press that we get or anything that we attend, we're raising up the issue of this funding. And we're also pushing them to do what's right and release that funding as soon as possible. And we've been able to lift up groups who got awarded funding. But like I said, allocation is one thing and distribution is another. So I think that what we can continue to do is make sure that our elected officials are informed. We do. And thank you, Vinay, for that directly impacted myself. I was homeless in 2014. I don't know what it's like to be homeless today, but I know what it's like then. And that's what we're seeing with people who are impacted. So it is important that we have people who are impacted on many levels. And the last thing I would say, we've been able to take our members and leaders and let let them hear directly from them, who some are still using, some are in recovery, and some have been in long-term recovery from chaotic use. And so having that distinction, and we followed them so much that they even pulled us and they said, are you all going to apply for the funding? We said, no, we want to make sure that funding gets to the groups, the services who, and the folks who are providing the direct services. So this is so important in this conversation because people think it's all good, but in our local, we've learned that our mayor's administration announced that they were going to allocate funding, but they didn't get it approved through the council first. And so we were able to contact our local Metro Council. They recently approved it. And so now we got a real tangible schedule on when those monies will be dispersed.
Wow, this has been really great. I love being on a call with experts. It's always really fun. So, okay, I do want to pause here though and say now is the time that we want to open it up to any questions from our attendees. So again, you should have a Q&A button at the bottom of your Zoom screen. You can type your question in there and we'll go through. I'll probably give it a minute or so for questions to come in. And again, once you enter your question, I'll go ahead and read the name of the person we're going to unmute. We'll unmute you. You can ask your question. We'll have a response from one of our panelists. But in the off chance that we don't have questions, I also have a couple more things for discussion that we can open up as well. So I'll give it a moment now if folks have questions that I want to answer, or they want to enter. All right, I will keep us moving, but again, the Q&A is open if folks want to drop stuff in there. And so I actually, I guess I have a question for Trisha. I'd love to hear from you again. You know, what are your thoughts on how jurisdictions think about balancing spending funds quickly versus taking their time to spend on the plan and invest in the long term? So talking about timeliness here. And yeah, Trisha, I'd love to hear from you, but if anyone wants to throw down after that, that's great.
Yeah, that's a great question. And I think we've heard so many folks, particularly like folks who are on the ground, small community organizations who are always strapped for funds. They're like, we're ready, give us the money. And sometimes it's just like, it takes so long to get all these processes set up and you're moving at the pace of government, which is never the pace you really want to be moving at when you're focused on saving lives. But I think I try to have some sympathy for these government organizations or, you know, whoever is being set up to do this, because it is a lot of work to get it set up. They are very interested in being transparent most of the time. They're very interested in like being fair. So they're really trying to get all their, you know, their T's crossed before they start. I think some things can be really obvious. Like if you're in a state that doesn't have really good naloxone access, then maybe your first step is to like really blanket the state with naloxone. But even then, like you have to prioritize targeted distribution, right? Like you need to have a plan to get that naloxone into the hands of people who are truly at risk of overdose, not just giving it to law enforcement and not giving it to some department where it's going to sit on the back shelf. But maybe that's kind of like an obvious first step. Like, let's get the money out the door right now to do something like that. Other jurisdictions, maybe they've like made plans to address the overdose crisis for years. So they have a long wish list that they haven't been able to fund. So they might be able to start funding those things pretty quickly. Other jurisdictions, like they really haven't thought about it, especially if we're thinking at the local level, like they haven't had the power necessarily to do a lot of this work before. So maybe they want to use the first of their funds to do a needs assessment, or they really want to go around and hear from the community about where the gaps in the system are and how they would like to see the funds spent. So I do think that like creating time to get all of that input is also really important. I think where folks get really frustrated is if all of this work is supposedly happening, but it's happening in the shadows and we just have no idea, like, where is the money? To Shamika's point, you know, the awards were made in Kentucky in the spring, folks still haven't seen the money, and it sounds like they haven't been given an indication of when they're going to see the money. That's very frustrating. At least if they were told up front, it's going to be a while before we get it to you, then I think folks would at least have a better understanding. They could plan for it and all of that.
Super helpful. Yeah. I did see a question come into Q&A, and so I'm wondering if my helpers on the back end, it could, let's see, we're gonna unmute Jennifer if you wanna, Jennifer Goldsmith, if you wanna come off mute and ask your question. Let's see. Maybe we, yeah, let's see. And I think we might be having trouble unmuting, so but we're gonna figure that out. Let's see, I'll keep it moving knowing that we've got some time left. Let's see. So Elizabeth, do you feel like decision makers have, or really to anyone in this group, what are some of the misconceptions that are coming up around harm reduction when you're having conversations with stakeholders, lawmakers, again, any decision makers? What are the common misconceptions that are coming up when you're talking about harm reduction and why we need to use the funding for that?
Thanks, Mariah. Yeah, so as my colleagues here have said, harm reduction strategies include syringe exchange programs, safer injection facilities, overdose prevention programs, and essentially providing healthcare for a disease model, right? So stigmatization is embedded in many decision makers' conceptions, including moral failure. I hear it every day. Criminal behavior. I worked with somebody recently who was told, I'm going to get you out of this town one way or another in a body bag or in police in handcuffs. And also the belief in abstinence only models. So in general, there's like this fight against drug use rather than full acceptance that drugs have been and always will be used. They work until they don't work. And I don't know anybody in our society that has not found some kind of reward in drugs or alcohol. So the public gets really mixed messages, and therefore so do our policymakers, right? Even the press gets mixed messages. And those get sort of perpetuated. And that's, you know, people only know what they know. So we have to just keep using our voices like we are here. And we have to really use the voices of policymakers and medical professionals, right? Because there are a lot of medical professionals that are getting on board because they see the science. And there are policymakers too, who've lost children and friends who've lost children who actually care. So all of us need to really keep, all of us who support it and understand harm reduction as a disease model just need to keep speaking up and banding together, because we're stronger together than in silos. And that, I think I saw Jennifer Goldsmith's question that she couldn't ask verbally. So it says, how do you work together as organizations and communicate? How can other organizations come together with this as a movement, since there is power in this collaboration, right? So that's exactly what I'm talking about. All of us coming together and meeting each other and talking about what each state is doing or not doing. We have collectively built more power and created this roadmap for everyone to get a hold of. And, you know, actually, so the National Sea Change Coalition, you know, wants to keep bringing together all of these states so that we can continue using this platform as a collective voice in all of the important work that we're doing. So I just really think that there are really deep embedded misconceptions because of that. I don't want to say the war on drugs has been successful, but their marketing plan has worked. And it's really given us our jobs like that much. It's made our jobs that much harder. We have to re-educate. And I feel like I think all of us here are doing that on a daily basis. I mean, we're even re-educating the press. We just had a great coverage last week, and you know, the language was not really appropriate, and the visual was not really appropriate. It was steeped in stigma. So we corrected that reporter, and she was awesome, and she was like, thank you for letting me know. It's just, you know, we have a big job, so we need to stick together.
Mm-hmm. Yeah, absolutely. Yeah. And that's why at Vocal New York, we've talked about that a lot, you know, the phrasing of the failed war on drugs, when in reality, it's acting and working exactly as it's supposed to. So it wasn't really a failure. I guess it depends who you ask, right? But yeah, I wanted to uplift to, thank you, Elizabeth. You had mentioned Jennifer Goldsmith's question that we couldn't unmute for, but I'll read it again and see if other panelists have answers. And then I think I have one more question after that, and then we'll wrap up. But again, to Jennifer Goldsmith's question about how our organizations are working together and communicating, and how other organizations can join this movement, build power, and collaborate. I'm wondering, Vinay, do you have any thoughts on that?
Yeah, I think that's such an important question, because like, as folks are listening to all this, I'm sure it sounds like daunting and complicated, like 50 different states and rules, and what do we actually do about it? And the good news is, like, regardless of what state you're in, there are organizations already doing this work. So as a first step, I would just try to find out who those organizations are. Like, if you're in Kentucky, talk to Shamika. If you're in New York, talk to Vocal New York. And like me, in a position as a national organizer with, you know, dozens of affiliates, like, reach out to me. I can plug you into organizations all across the country. Like, you don't have to reinvent the wheel. Like, so much of this work is ongoing. So that's a first step. There's also, just as a resource, it's worth flagging. There's a website called Opioid Settlement Tracker.com that has just a wealth of resources on every state, 50 states. Christine Minhee put it together. It has like a 4-page advocacy summary for each state. So if you're curious, like, who is deciding these things in my state, how much is transparent, how much is not, you can look all that up there. And then also, like, just some words of encouragement. I feel like some folks think like, well, I'm not like a lawyer or an expert, so maybe this isn't really my fight. But like we always tell people, like, you're experts on your own personal story. And if you're on this call, I'm guessing you or your community have been directly impacted by the war on drugs. And that's all you need to do this work. And the work is effective, right? Like, Vocal is on this call. I mentioned the OPCs in New York. They wouldn't exist without Vocal New York and the years of advocacy and organizing. So when you put in that work, like, look at the results, right? Like, over 1,000 lives saved over the last year. That's like so tangible. Like, a lot of the times in healthcare work, it's very like conceptual, like we don't know what the impact is, but this is like directly observable, you know, lives saved. And that's like what we should be grounded in. That's what is at stake here. That's what we can accomplish. So yeah, look into those resources, contact anyone on this panel. We can plug you into the fight. It's definitely worth doing the work.
And then Shamika,
sorry, I was going to say, I mentioned Shamika is in Kentucky doing this work on the ground. I'd love to hear your opinion on what exactly folks can do to plug in, because I know you're the expert on this.
I appreciate that, Vinay. Awkward silence always gets me. I'm like, do I jump in? At Vocal Kentucky, we had no choice. As it's been said before, we stand on the shoulders of Vocal New York, who started out of the AIDS Act Up movement, and got so many great things accomplished. So New York is definitely goals. But when I was hired, I was like, this is Kentucky. We're the gateway to the South. We want to get there, but there's a pathway to get there. And at Vocal, we evaluate success through our ability to move people to action, the strength and depth of leadership, developing that leadership, ability to shift the narrative, and concrete victories and wins, both big and small. And so we do that through the leadership development, through organize. And many of us that are on this panel and on this call started out as organizers and went in different paths. But I will tell you, the coalition, the intentionality of being collective and working across lines of difference is what has helped us be successful. We're just over a year old here in Vocal Kentucky, but we've been able to help shift the narrative, move the needle through our coalition efforts. And it starts with people, like Vinay said, who are already on the ground. And so we showed up like their muscle to amplify and lift up their work, and also bring in those impacted voices. And for me to go from being a child who grew up with the DARE program, who almost became a police officer, but who watched her father and her uncles criminalized over and over again, to speaking in front of the DEA on their 50th anniversary, and talking about those stories of what it was like to grow up watching my family, my friends, my loved ones, my mom, my dad deal with the opioid crisis. And so we do that by exposing our members and our leadership to opportunities to connect to groups that are in our state and across the nation who are impacted by this. For us, it's less about the lines that separate us and more about this issue that unites us. And so we can use this crisis and the funding coming through here to start to improve and make a difference. But we also have to be willing to get out of the way when we need to make sure that those who are saving lives and who are improving lives on the ground are amplified and lifted up and able to help influence better policies across our state. So we had no choice but to operate as that. We held the first symposium, and we called it we all love people who use drugs. And we dealt with it from that point of all of us are impacted by this issue, and we have to be real that we're meeting people when at the end of their rope or when they bottomed out, but we're not dealing with the masses of people who continue to use drugs. And we treat it in this bourbon state. We just like you can go to any bar and get alcohol that has been treated. We try to approach harm reduction to let them know that harm reduction is all those things. And the fact that you can go to a bar, choose to drink all night and go home, or you could go to a bar and never go to a bar again, or you can go to a bar and go back the night before and get a ride home. That menu of services are there for alcoholics, and it should be there for anybody who chooses to use drugs or not. And so recovery is a part of this, but recovery is a step for anybody's individual journey. So we do this collectively. Everybody has a role in this, from our elected officials to our judges to our prosecutors and to the organizations that fight together to save lives.
Thank you for that, Shamika, Vinay, everyone. Okay, so I think we're winding down. We got 10 minutes left. I'm gonna do one last question speed round. I think it's pretty straightforward, that I'd like to hear from each panelist, and then we'll wrap it up and end. But what's something, we know the important role that reporters play in this conversation, the national dialogue around harm reduction and these settlement funds. What is something that some tips or pointers you'd like to share with reporters when they do their coverage on this, the roadmap, or anything else having to do with the harm reduction? Let's kick it off. Trisha, do you want to give your pointer first?
Sure. I think as representing the Appalachian region and a lot of the work that I do, I think we often see the whole region, including Kentucky, I see Shamika nodding already, really in a negative light in the context of drug use. And I think there is truth to the fact that like the Appalachian region is ground zero for the opioid prescription crisis, right? And like the pharmaceutical grade. However, there's also so much positive things happening in the region. There's so much good work happening from folks on the ground. There is so much culture in the region that is really never talked about. So I just would suggest to reporters to like, don't just focus on the bad numbers. Look at like what is being done to really address it, like where are the positive aspects, and bring the people into it, the people's like own personalities and like community culture, and like what does that look like? I think those can be the best stories to really understand the problem and what the solutions can be.
Awesome. Thank you. Vinay, do you want to go next?
Sure. Yeah, I think I would have like two major takeaways for journalists. One is that sometimes like writers shape the debate between like public health and carceral approaches as if they're two equal sides. And they're not. Like, just to make that very clear, like harm reduction is public health, like that keeps people safe. Policing, prisons, those are not institutions of care and healing. Those are institutions of violence. So it's not like two viable options. It's one viable option and then one wrong choice, which we've been doing for decades. So that's one thing. And the second thing is, and Elizabeth mentioned this earlier, is that, yeah, there's a misconception that to end the overdose epidemic, you have to get everybody off drugs. And that's not how this works, right? Like people lot of people want to continue using drugs, and we need to keep them safe. So I always say, like, not everyone seeks sobriety, but everyone does seek security and safety. And we can give them that with a clean syringe or drug checking equipment or a safe space to use drugs. Like, that can be our role here. So those 2 points.
Thank you, Vinay, so much. All right, Shamika.
I got a laundry list, but I'll start with just listening to those who are directly impacted by this issue, hearing the story, and making sure that we portray this in there's many lights. And I know, and thank you, Trisha, for lifting that up. In rural and in Kentucky, period, it's always shown in a negative light. And so the way we portray substance use, it also impacts the children. So I think the media plays a big role, and know that we appreciate the media, even if we're nervous about it. So, like, take the time and listen to folks, and go and check out these sources. A lot of people present one thing at your press meetings, but what happens day to day is different. There's a lot of trauma happening in recovery centers or places where people are supposed to be getting healing. They're being hurt, and it's causing them to make terrible choices. So making sure you follow, there's a saying about who's putting the babies in the river. Go up the river as far as you can to look at the sources, because a lot of times people want to point at what's happened as a reaction, but not what started that. And so bad decision-making, violent decision-making starts in the boardrooms and where funding is dispersed or taken away from. And that can be, and so a lot of times when you're showing up, you're seeing what happened after they closed the mental health facility, or they stopped syringe exchange, or they had to shut down mobile trauma response or mobile response units. So making sure you go up the river and find the real source of the issues. But yeah.
Okay, thank you, Shamika. All right, and then over to Elizabeth, and we'll wrap it up.
Good stuff. So yeah, I think I agree, obviously, with everybody and what they've said. It's super important. Keep using us as the experts. Keep using people who are using drugs as experts on themselves. Not some kind of, imagery of, I keep thinking of the images of slumped over people, and these are human beings who have lives, who want to have a home, that want to be able to eat when they're hungry, who don't want to die, and they call us every day. They don't want to die. Why am I having abscesses all of a sudden? So the thing is, like, I also just really want to stress is language matters. Language really matters. I say this all the time, and I know maybe you've heard it, but when somebody has a diagnosis of cancer, we don't call them cancer. So if somebody has a diagnosis of substance use disorder, don't call them addicts. I mean, it's really basic, but I hear it all the time, and that we just need to keep looking at this as a disease model, and that harm reduction is healthcare, and that harm reduction ultimately is love. And I think all of us need more of that.
And I think that's the best note to end on, Elizabeth. So thank you so much for that. And thank you to everyone who attended. We're all wrapped up now. Other things, just again, housekeeping. We recorded this, and so we'll definitely be sending around a release with the recording. So you'll be able to get that. All of us are definitely available for one-on-ones. So either reaching out to whoever gave you the advisory for this discussion, or any one of us through our individual groups, through Twitter, whatever it is. We're here to help you, and we really appreciate you joining and listening to us and listening to this discussion. So I think I will close it out there, and I hope everyone has a great Wednesday. Thank you so much.